You're listening to All Sides. I'm your host, Anna Staver. Drinking water contaminated with lead is harmful to children and adults of all ages. Even low levels can damage developing brains, reducing IQs, increasing the risk for attention disorders, speech delays, behavioral issues. And yet, daycare centers across Ohio still have tap water that flows through lead pipes. We've been talking about how Ohio is working to replace those lines. Now I want to pivot to the health impacts of inaction. Joining me is Edward Johnson, the Assistant Health Commissioner for Columbus Public Health. Welcome to All Sides, Edward.
Good morning. Thank you for having me.
And Dr. Joel Davison, a pediatrician at Akron Children's Hospital's Lead Clinic. Welcome to All Sides, Dr. Davison.
Thank you, Anna. Thanks for having me.
Dr. Davison, I want to start with you. Why is lead exposure more dangerous for children than adults?
Yeah, thanks for the question and for highlighting this issue. So we think about lead. Lead's a heavy metal, a toxic heavy metal. It doesn't have any purpose in our bodies. We don't do anything with it. But lead can be irreversibly harmful to young developing brains. Lead does not have the same impact in older brains that it does in this first 0 to 5 years of age. And so that's why we talk a lot about younger kids being screened and evaluated for lead poisoning because of those lasting neurocognitive impacts in that developing brain.
What are some of the symptoms a parent should look out for? Like, what would be a sign that perhaps they need to get their kid tested for lead poisoning?
Well, one of the challenges, Anna, about symptoms is that actually at lower levels of lead poisoning, it's not eminently obvious that your child has been exposed to lead. At really, really high levels of exposure, so we're talking about levels that are like in the 60s or 70s or even higher, kids can have like a slowing, a mental slowing. They're just not acting right. But most kids actually are pretty asymptomatic, at least in the initial parts of their exposure. What we worry, and that's actually why kids need to come into the doctor's offices, come in for their checkups, and get screened and evaluated to see if they've been exposed to lead, especially if they're in a high-risk environment. And we'll get to be talking about that, I'm sure, in a little bit.
Edward, we talked earlier about Cleveland's higher rate of lead pipes. What do we know about pipes and risks here in Columbus?
Absolutely. So I think when it comes to pipes and drinking water in Columbus, the first thing to know is that this is something our Department of Public Utilities has been aware of and has been on top of for quite some time. This isn't something that just popularly was known and then we acted on. So I would say probably for the past decade or two, Public Utilities has been taking the inventory of water pipes, pipes through which water travels, and they've been saying we need to take an inventory. We need to know what the materials are that constitute that. I think that we are below 20% of what's known and unknown. So what's unknown is less than 20% of our inventory, and we're getting a very good hold on that. And so the work that Director Kristen Atha is doing, her predecessor, Director Tracy Davies, her predecessor, even Director Greg Davies, they've been working on Blueprint Columbus, which is to seal those lead service lines and to remove them from service. So we know that we've been very proactive about this. And what we feel is that lead exposure is not necessarily going to occur from drinking water here in Columbus. I think there are other environmental factors such as homes and lead paint where we're more concerned here in the Columbus area.
What kinds of services or screenings does Columbus Public Health offer?
Great question. So we always want to start with a screening for children under the age of 6. This is basically a finger prick where we're screening the blood to see if it's going to come back with an elevated blood level. This is something that should be happening or could happen through the pediatrician as well. And so for us here at Columbus Public Health, we are working on a pilot project in 3 of our historically red line neighborhoods because we know the history of disinvestment in the housing stock there. And so what we're using with our public health nurses and our WIC clinics and at other community sites is to offer that finger stick to say, hey, we're concerned. We're able to do the screening. It takes a couple of minutes. And if it comes back elevated, we do offer the family the opportunity to have a confirmatory test, which is a blood draw. So when you're dealing with kids under 6, that's
Not
a little
fun.
more Not fun, yes. And we offer it there because we want to close that gap between screening and confirmation. But we also understand that families may say, hey, I want to do that with my pediatrician. It's a little more invasive, it's a little more of a controlled environment. But we want to make sure that that's available because we know that about in our three pilot neighborhoods, which are Linden, the Near East, and the South Side, there are about 7,500 children living in high risk or at risk housing units here in Columbus in those three neighborhoods alone.
And I do want to expand this conversation beyond lead pipes. I know it's been the focus of this hour, but Dr. Davison, you can get exposure from lead paint. You can get it from playing in the dirt outside of an old home because the paint chips have flaked into the soil around the house. What how do I know, I guess, what do I do if I live in an older home?
Yeah, so Anna, everybody really kind of in the lead world thinks about 1978, and that's the year that we really removed from a public health standpoint, using policy to get lead out of paint. And so, if you live in a home built before 1978, that's something that is at risk. And I'm glad that you brought up water, and we're talking about water, kind of started talking about water pipes, but water damage is actually another really big contributor to lead, even when your house has been renovated or updated or what we call abated, like where we've kind of deemed it to be lead safe, reasonable, that there's lead somewhere in that built environment, but it's not to the point where it's actually getting aerosolized. There's no dust from that lead. It's not on surfaces, and so forth. But any water damage, like the water out on the side of the house, the drain pipes aren't working correctly, or there's a leak in the second floor bathroom that comes over the kitchen or into the dining room. Those can be exposures because you're unroofing kind of some of the history of that home. So that's an important exposure. We've done a lot in the public health space also to evaluate child care centers and daycare centers and schools, to minimize this exposure. Um, so those are the common areas. I think the other thing that the Centers for Disease Control has identified recently, we've in a pediatrics supplement that I was actually a pleasure to be a part of. Um, Firearm use is increasing, and dust and debris from that exposure is a real problem. We've heard about lead from food, and as we kind of think about our nation, international supply chain related to food and the assessment of the pieces that go into what our children eat, that's a growing exposure. And then just the e-commerce exchange, like just buying things online, not knowing whether the toys that you're buying in those settings have lead in the manufacturing process. So those are some additional kinds of things that we need to be thinking about.
I will say you can buy lead free bullets. They are more expensive most of the time, but if it is something that is very concerning to you, it is one way potentially to reduce your exposure. I am somebody, though, who loves old dishes. So I know that antique dishes, even cookware, can also contain lead. And, friendly PSA, if you buy vintage Pyrex, if, say, grandma cooks in an old baking dish, a lot of old glass is leaded glass.
And you're absolutely right, Anna. We have some of those heirlooms in our family as well, and we've kind of since because of that knowledge, just kind of wrapped them up and kept them, in the like remembrance phase, but without kind of using them on a regular basis. So thanks for bringing up that exposure. And sometimes families that we've identified that have had high levels of lead, we sometimes cannot identify that source of lead in their environment because there's so many different places that lead can come from. And I'm glad that you also talked about the outdoor exposure. We see more lead cases in our clinic in the summer months because kids well, first of all, the doors are open and covered porches are, that are exposed to the weather are a common source in those older homes. And if those windows are being opened and closed, that develops, just some of that lead dust that kids can get exposed to. But also just being outside. And, we had lead in gasoline. That was another thing that we removed from the system, which had great public health impacts and greatly reduced the lead exposure in children. But we still have a legacy of that and in industry throughout various parts of Ohio where, lead became aerosolized and then rain brought it down into the soil. So if you are gardening in some of those areas where we know that there's a higher proportion closer to a freeway, and making sure that you're putting raised beds in and gardening in that way is
Yeah.
helpful.
If you live, also, I believe airlines still use leaded fuel. And so if you live close to an airport, your exposure may be higher, particularly because as they take off and land. I do want to talk a little bit, Edward, about Columbus has resources for people looking to renovate their homes. They also have training for contractors looking to get certified. Can you share a little bit about that?
Absolutely. So, Columbus Public Health, in partnership with the City Department of Development and the City Department of Public Utilities, through our website at columbus.gov, we are looking to help assist just getting lead out of homes, getting it out of this environmental threat. And so, what we have come to find is that we have made a lot of strides, particularly in the mid 20th century, to say we need to get lead out of society. But I think we need to recognize, those major public health policies, those were implemented 46 years ago. Human beings have been using lead for thousands of years. And so this is a major change we're trying to make in 5 decades. And so what we want to do is provide those resources to not just encapsulate. Encapsulating is a good medium term solution, but always has to be checked. We want to provide those resources to get lead out of the homes. And so a big part of that is going to be replacing old doors and windows, these high friction surfaces that really move and kick up lead paint dust in the homes. Um, we still want to get it off of your walls that aren't necessarily moving, but we find that those are less the source than it is the old windows and doors that move. You're opening them, you're closing them, they're kicking up dust. You have children crawling around. Um, you know, you've got toddlers engaging in kind of hand to mouth behaviors. And so that's where we see a lot of those exposures coming from, and we want to replace those. Additionally, I know public utilities are starting to engage in a program where the hookups that are on individual property owners' land, or well, underneath the land, as the case may be, we're offering a program to replace those at no cost to the property owner as well, to say, how do we just want to remove the lead. Let's get it all out. Let's remove everything that we possibly can to remove that risk from people being in their homes. Additionally, we're not just looking at the homes where children live. Um, if they stay with grandma and grandpa, that could be a place where there's a risk. We talked about what are some of these sources. Um, Knowing that lead has been part of the human experience for 3, 4, 5,000 years. Um, at times when we do case investigation, we have found the sources of lead poisoning to be makeup and other cosmetics or skincare products that families are using as well. And so we want to do that comprehensive investigation. We'll look at the home, we'll look at the water, we'll look at the cookware, as you mentioned, especially if it's older, or if it came from overseas. But then we're also going to kind of look at what is the daily routine as well, because we have found that some of those things have been the source of lead poisoning, particularly in young children.
I thought lead in makeup was prohibited. Is this you bought something from overseas and it came in with lead?
Yes,
Okay.
our investigations recently are almost exclusively seen it in imported products.
That gave me a small heart attack. So I just wanted to double check. Also, Edward, I wanted to ask you, how do I make sure that a contractor is certified to do this kind of work? Because it can be expensive, and you want to make sure that they're properly sealing everything off.
Absolutely. So you can always ask to see their certifications to see if they have lead remediation and removal certification. That's something that we here at Columbus Public Health, we are offering that free of cost to any contractor that wants to come in and receive that. We're also offering it in both English and Spanish, because for us, it's a workforce development piece. And we look at essentially the old 1960s borders of Columbus. And we know that there's almost 160,000 housing units within those borders, which means there are 160,000 at-risk units. We want to make sure that anyone that works on those has the certification. This is a completely okay thing to ask a contractor if they have that certification, because if you live in an older home and they start working on it and they don't properly seal off, they're not properly controlling lead dust for remodeling or renovation, you have created an environmental threat and risk to your family and to any of the people that visit your home.
Dr. Davison, how do I begin this conversation with my pediatrician? Like, how do you say, do you just come out and say, I would like my kids tested for lead?
That can happen, and especially if you identify some risks after like this conversation and a little bit of research. There's so many resources available for families to kind of understand the issue that we've been talking about today and some of these risks. So if your child, if you're concerned about it, you need to talk to your healthcare provider about that. In Ohio, overall throughout the state, we have 40% of kids who should be tested, either at the screening occurs at age 1 or age 2 if you really live in a high-risk zip code, if you have Medicaid as your insurance coverage, or if you have some known risk exposure based on some screening questions that we ask. And we're missing a lot of children. So there's maybe even some healthcare providers or hospital systems that are listening in on this conversation. And on the healthcare side, our responsibility is to, in my opinion, is to get that testing while that patient's in front of you. Many offices have a challenge of not drawing blood or not drawing that finger prick right at the point of care, right when the patient's in front of them. And that's a systems thing that those offices and those hospitals need to figure out, I think, in order to get that screening improved. So, but yes, if you start talking about this with your doctor, they do have a lot of knowledge about this issue and can help navigate some of the complexities, some of the resources that you've been talking about with Edward from Columbus Public Health and any other local health department that families may have access to. There's lots of available information, and that starts with a conversation.
And if you're eyeballing your dishes, I will say, I personally like the 3M lead check swabs. You want to buy a lead testing kit at home that's like EPA approved for accuracy, but that could be the jumping off point for having a conversation with someone like Dr. Joel Davison, a pediatrician and co-director of the lead clinic at Akron Children's Hospital. Thank you for your time today, doctor.
You're welcome. Thank you for having me.
And thank you to Edward Johnson, Assistant Health Commissioner for Columbus Public Health.
Thank you, Anna. Have a great day.
And thank you all for listening to All Sides on 89.7 NPR News.